Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD this morning. We're doing a morning one today because once a month I try to make it a better time for our European members as well as our Middle East members to reach us. So that's why we're going so early. I know it's very early. It's at 8 o'clock in the morning out in California, so I know that's a bit early. So this is, as many of you know, this is the last time we're hosting this through Lyme United. But I did want to address how we'll keep doing it. Okay. So after today's webinar, we will keep running the webinars in this Zoom room format. And I want to show you where you'll go to sign up in the future. All right. So let's see. I'm going to do a quick screen share. Get rid of that. Okay. So in the future, and this is actually for the next 5 days, and then I'll tell you what to do after 5 days. You're going to come to my Treat Lyme by Marty Ross MD site. You're going to click on the Q&A webinar screen here, and down here, there's two things. You can this button will be changed to sign up, and this is where you'll go to sign up for the next webinars. I also want to let you know this is where you can come and watch the latest version of the webinar. All right. Now, what is changing is on Monday, I am moving all of this content for Treat Lyme by Marty Ross MD into a newly revised version of Marty Ross MD supplements. And I'm just going to show you quickly what that new site's going to look like so you know where to find things. Don't try this URL. This site is not active yet. So I want to make clear about that. All right. But in the new site, I have brought together all of the content of Treat Lyme by Marty Ross MD. It's in this area called Treat Lyme Guides. Okay, so this is where you'll find all my education sites. And then this tab called Q&A Webinars is where you will go to both sign up. You'll click this sign up button. Let me see if I can get that out of the way. You'll click this join now button here, and then to watch the recorded webinars from each week, you'll click here, basically. Okay. So I want you to know we're still going to run this as a Zoom room format. And when you register in the future, you'll actually be registering on a Zoom form later this afternoon or early this afternoon, my time. If you go to treatlyme.net, the Q&A webinars page, when you click the sign up now button, it will bring you to the sign up form for Zoom. Okay, so I just want to let you know I'm not going away from doing these webinars. We're going to keep doing them. I'm just going to be doing them from now on as a straight Zoom room outside of Lyme United. All right. Okay. And then one other piece of business today, or a few more pieces of business. So I am creating a recording today's webinar, and today, once I get it done early this afternoon, I will post it up in the Zoom room space at Lyme United. But it also goes up live on YouTube. And again, the way you would find it after I close things down tonight in Lyme United is you would go to my Lyme Q&A page at treatlyme.net until Monday, and then eventually at treatlyme.com. Okay, you can find all the recordings there. All the old recordings are there as well too. So nothing has gone away in terms of the recordings. Okay. And then in terms of today, the way these webinars work, you write your questions to me in the chat box, and then I will take them one at a time. We'll work through as many of these as we can. After I take a question, then I open up to see if you have other questions about what we just discussed. Not a new topic, okay? The only way we get to discuss your new topic is if you write it in the question space, okay? So I want to be clear, when I open it up for more questions, it's only to discuss further ideas around the question we've been discussing, all right? All right, so I think that takes care of it all. Glad to be with you here one last time as part of Lyme United. And I see we got a number of people that have showed up today too, so that's really good. All right, so let's go ahead and get started here. I believe this first question is from Tracy because she's always here as Zoom user.
Yep,
So,
that's me.
yeah, yeah. So Tracy, there is, and I'm blanking on her last name. There is a ILADS member, LLMD out of the Philadelphia area, and her first name is Anne, and I just cannot think of her last name. What you might do is I know that Pennsylvania Lyme Disease Association maintains a list of practitioners. You might want to look there. And if for some reason my 63-year-old brain, yes, I turned 63 2 days ago, if it cooperates a little better and I can remember Anne's last name, I'll let you know because sometimes my brain keeps working on it and hopefully it'll come to me here in a minute. Okay. All right.
Great, thank you.
Good luck.
And did you see the second half of the question?
Let's see. Can you recommend any, as you know? Oh, no, I'm not doing physician consults. So partly what happened is before the pandemic, I was willing to do consults with people anywhere in the United States. But what became very clear in the pandemic is if you're going to give medical advice in a form of a one-on-one kind of situation, even if it's a consult, medical boards look at that as a physician-doctor relationship, and they demand that you actually carry a license in the state where the person lives, not where you live, but where the person lives and when you're talking to them. Okay. So I no longer do that out of fear of getting my Washington state license in trouble, basically. All right.
Okay.
Yeah.
Um, Thank you. And also, I'm so excited to hear that we're still doing this is a Zoom
Yeah.
seminar. It's just
Yeah.
so helpful to have the back and forth, really.
Yeah,
So
I think so too. And it's worked out pretty well. I mean, we'll keep doing it. I see no problem carrying forward doing it. And fortunately, I've been able to set it up with Zoom that I can do this outside of my Lyme United format as well too.
made my day.
All right.
Thank
Thanks,
you.
Tracy. Take care. Bye-bye.
Bye.
All right. Next one's from Jackie. Let's see. Since many years, I have severe abdominal distension despite being underweight. I do not have SIBO, SIFO, obstipation, mold fungus, or flatulence, and I'm taking several kinds of probiotics and polyphenols. I thought that maybe the distension could be due to parasites or maybe due to fluid retention. I'm currently following your Bartonella protocol. I'm slowly building up on the dosage, and now I'm taking 100 milligrams of itonazol and two 25 milligram methylene blues per day. In addition, I take Japanese knotweed and cryptolepis and Chinese skullcap. I'm thinking about doing a 3-day parasite cleanse to see if it will get any reactions. Can I do this while on the aforementioned Bartonella protocol, or could abdominal distension or fluid retention be related to long-term Bartonella? Thank you. All right, that's a great question. So let me, I'm going to ask you some questions. I'm going to say something. I'm going to ask you a question. Okay. So you've highlighted what common causes would be of bloating. One is yeast. One is small intestine bacterial overgrowth. The other one is small intestinal fungal overgrowth. All right. And the other one, is yeast is a big one in there too. Okay. My question is, have you had any intestinal testing done to get an idea of what the makeup is of the bacteria and or potential parasites in your intestines? Have you had any stool work done?
Oh, yes, I have. And there was a dysbiosis and due to too little lactobacillus.
Okay. And did they do any testing for parasites at that time or not?
Yeah, parasites and yeasts and everything, they were always negative.
It was negative. Okay. So a couple comments on negative testing for yeast and negative testing for parasites. So negative testing for yeast does not mean you don't have yeast. The problem is with these tests for intestinal yeast, they're going to be measuring, do you have yeast in the intestines and what is the quantity? And they're not perfect. The other issue is what really you're interested in is knowing for you, do you have a relative yeast overgrowth? So it's possible that on these tests, they say you have normal amounts of yeast because we all have yeast that lives in our intestines. But what's being reported as normal compared to all people may not be your normal. It may still be high. Okay. So for diagnosing chronic yeast overgrowth, I always like relying on my yeast screening questionnaire. I'll show you that in a minute. It's more symptom based and if you score high on it and you've never treated for intestinal yeast overgrowth with at least a month to 2 months of agents to kill yeast, that's where I would start first. Okay. Even with negative testing. Okay. All right. All right. Second thing about parasites, there's been some good studies done looking at how good testing is to pick up parasite infections, and it's only about 30% effective. So you could have intestinal parasites living in your intestines and not have positive testing for it. All right. So one of the things that I did in my practice is if somebody had a lot of gasiness and bloating, and I did a good job of making sure they didn't have SIBO, SIFO, and I took care of intestinal yeast overgrowth, and they still had a lot of intestinal gasiness and bloating, then I was going to start wondering, do they have intestinal parasites? And in people, and I might still do a parasite test just to see if we could find something on the parasite test, but if it's negative, it doesn't exclude it, okay? But if it does come back positive, knowing what you have then makes it so you can do a better job of targeting the agent you're going to use to kill that parasite, all right? But if testing is negative, then I wanted to spend time trying to figure out with my patients, was there a risk that they could have gotten intestinal parasites? All right. So one of your biggest risk is international travel. If you've gone to less developed places, you've had food from vendors, it's possible you could have picked up a contaminant. And especially if you traveled to Mexico, for instance, and you came back and you had diarrhea afterwards, maybe you got it that way. Okay. All right. The second group of people that I wonder about intestinal parasites are people that are backpackers, hikers that were good about drinking water out of mountain streams and didn't do a good job of filtering it. All right. And then the third group of people that I wonder about intestinal parasites are people that drink well water, even if the well water has been tested, because there still is the possibility of a groundwater contamination getting into your well water and you drink it. All right. So in people that had a lot of gasiness and bloating, we took care of yeast. They didn't have SIBO, SIPO, and all that stuff. Then what I might, even if their testing was negative and they had risk factors of travel or mountain streams or well water, then what I would do is to do what I call an empiric treatment using a anti-parasitic agent that's a broad spectrum agent, meaning it's designed to kill all kinds of parasites. And on the prescription side, that is a medication called Alinea. Alinea can pick up about anything that's a parasite. And I would have people do 500 milligrams of it twice a day for 3 weeks. The reason you treat for 3 weeks is when you're treating parasites, not only do you got to kill the living ones, you got to kill their babies as they hatch. And babies will hatch when they've laid eggs over about 2 to 3 weeks out. So you need to have them on that medication at the time the babies are hatching too. Okay. All right. And often that would be enough to get a person well. The other alternative, which does not work as well, is to use an anti-parasitic herbal preparation that has, at a minimum, black walnut in it. I don't know if the Cellcore product does, but you want to have something that at a minimum has black walnut. Sometimes they'll have artemisinin, sometimes they'll have cryptolepis in it as well too. But your main agent is going to be something with black walnut. The one I like using that has black walnut in it at my site actually is the one of the products I have that has black walnut in it is Biocide. And in this situation, I would do a Biocide drop or Biocide capsules, not the liposomal form, because the Biocide and LSF liposomal, that gets absorbed into your bloodstream and there's not enough left to kill a parasite. Okay. All right. So those are just some thoughts. So if your testing has been negative and you have risk of parasites, definitely I would try a course of Alinea or one of the herbals. And then even if you've done everything, you're still gassy and bloated. And even if you're not in one of those high risk territory groups for parasites, sometimes I would still try an Alinea trial just to see if it would make a difference for a person too. Okay. All right. So that's the approach that I would use to handle it. So Jackie, do you have any questions about that?
Yes, about the yeast you mentioned. I
Yeah.
thought that itonazol would kill the yeast if I had it. Is that correct or not?
So it should. So if you do, but I find better results. So itraconazole as an anti-yeast medication is probably better at a 200 milligram dose a day, not 100 milligrams. So 100 milligram pills, 2 pills 1 time a day. And I would want to couple it with another anti-yeast agent, either prescription nystatin, and that's a 500,000 international unit pill, 2 pills 2 times a day. And I would give that combined at least a month. And that seems to work about 90% of the time clinically to clear yeast. Okay. Or you could combine your itraconazole with an herbal anti-yeast agent, and herbs that are found in anti-yeast herbal agents are going to be garlic, caprylic acid, any of the volatile oils like rosemary oil, or oregano oil. So, for instance, there's a product I carry at the store that has caprylic acid in it, garlic, and oregano oil, and that's called Capri Plus. If I were to use that, I would use it at 2 pills twice a day. So it has ingredients in it that are known to kill yeast. And you could use that like 2 pills twice a day along with your itraconazole. And I would probably give that combination about 2 months to try to clear intestinal yeast.
Okay. Yeah.
Okay.
Thank you very much, and congratulations on your birthday, and thank you for
Oh,
getting up so early to
you're welcome. Oh, it's not too early here. It's 10 a.m. in Austin.
okay. Oh,
It's those
okay.
Californians that are having a hard
Okay.
time here this morning. Yeah. All right. I'm going to do a screen share just so that in case you don't know about this, I'm going to show you where you can find information about how to diagnose yeast with that questionnaire. So what I would do is take a look in my guide, look in my yeast section here, and then this article called "A Silent Problem, Is It Yeast?" And then somewhere in here, here is my yeast screening questionnaire. If you score over 140 on this, there's a high probability of having yeast. Okay. All right. And so that's one way to go ahead and do that. And then in terms of this product that I mentioned, just so everyone knows what it is, it's called Capri Plus. And that's the one I like using when I'm trying to take care of yeast. Okay. All right. All right. Let me get out of here. All right. Let's see. Tracy, I see your hand up there. And so Tracy, I think that's your hand at least.
Yeah,
It's Zoom again. Yeah.
yeah, that's me. I just had a question about there's a company called Para Wellness that
Mhm.
does a parasite test that supposedly is more accurate or sensitive. Do you have any
Yeah.
thoughts on that?
Again, so it may be, but there's a lot of errors, even in better tests. I mean, this is just what the science tells us, okay?
Mm,
So I have found clinically in my practice, if I have a strong suspicion based again mostly on risk factors, that somebody might have picked up a parasite, I have found benefit in just treating even when the test is negative using Alinea is the agent that I really like to use.
okay, thank you.
You're welcome. And Aliska, I see your hand up there too.
Hi, everybody. Yeah, I just wanted to ask, since Jackie was talking about her gut problems, can you actually test if you're taking a prescription antibiotics for like SIBO or SIFO or anything?
Yeah, so any of these tests that you're going to do. For instance, if I one of the workup steps that I like to do is usually when I've got somebody with gassy or bloated, I'm usually without getting stool testing, I'm just going to use my questionnaire, treat for yeast if I think there's a strong suspicion of it, okay? But if that doesn't work, the second step I'm usually going to do is to get a breath test for SIBO. If you might have SIBO, what happens is when you drink a sugar called mannitol, I think it's mannitol that's in it. If you drink it, that sugar will get fermented in your small intestine and it produces hydrogen and methane gas. And then using these test kits, you blow your air into a tube and you send it off to the lab. and you get measurements to see if you might have the gases that suggest SIBO. Okay, now I will let you know on that test too, the breath test is about 75% accurate at finding it, so it can still miss it 25% of the time. The gold standard is to work with an intestinal doctor who can actually, through scoping, can get a small tube down into your small intestine and pull some of the aspirate or liquid out of your intestines and then look under the microscope to see, do you have too many bacteria living there? That's the gold standard. But the quick and dirty way of screening is this breath test, okay? All right, now if that comes back negative, it comes back positive, treat somebody and they're still not getting better, then I want to go ahead and get a comprehensive stool analysis like a GI map, or Genova Diagnostics has their equivalent of a GI map. And this literally gives you kind of a good breakdown of what the bacteria are that there and whether you've got imbalances or excess growths of one and an imbalance of another. And it gives you ways of doing interventions based on what you're actually seeing in the intestines as well, too. And then finally, I do like what you're doing, Jackie, in terms of supporting your intestine microbiome. That's very important. Be on prebiotics, be on probiotics, and in terms of prebiotics, I like people to be on starchy sugar fibers. You can either get that as a prebiotic pill, or you can have a diet rich in fruits, vegetables, beans, legumes, and even beans and legumes are okay if you have yeast because the starch is bound up by fiber. Okay, all right. And then the other key thing is to make sure you're getting plenty of polyphenols. Polyphenols are not prebiotic. They're not starches. They're actually a chemical called polyphenols, but they feed good bacteria too. And if your diet is rich in colorful fruits and vegetables, you're probably getting adequate polyphenols. If you don't have a diet rich in colorful fruits and vegetables, then it's a good idea to take a polyphenol booster. And I actually have a product called Polyphenol Booster at the store, but it's rich in polyphenols, a couple capsules a day gives more polyphenols to your intestines and can promote healthy bacteria growth. Okay. All right. And then let's see. Theo, I'm going to come to you a minute. I see your hand up. I'm going to go for Lucy next, and then I'll come over to you. So, Lucy, I see your hand up there. Oops. Your microphone's not on, Lucy. Oh. Yeah. I don't know why I don't know why that's not turning on. Let's see. Lucy, I'm going
Oh,
to
I
go.
got
Oh,
it.
there you are. Okay,
Got it.
got it. Go ahead. Yeah.
In a public place. I just wrote in the chat also, I've had fantastic results with the arterosil around the
Yeah.
blood pooling, and I'm able to walk better. Like, it's so bad that I can't stand up. I can't walk. I'm turning every 2 hours at night like a rotisserie chicken.
So Lucy, hold on a minute. So we're still talking about stool issues. Is this a
Oh,
different
sorry,
topic?
sorry.
Yeah. Okay. So I'll get to your question eventually, and when I work through the chats. Okay.
Sure thing. Thank you.
Okay. Yeah, you're welcome. Theo, I saw your hand up there too.
Hi, this is off topic, but quick, just questions. Do you want everyone or directly to you?
Oh, to everyone. When you write a question, send it to everyone.
Okay,
Yeah.
thanks. Sorry for that.
That way everyone can read along as I'm reading
Yep.
it too. Yeah. Good question. Okay. All right. All right, let's move on here. You guys are having good questions today. We always have good questions, but I'm just noting today is a good one too. All right. Doug, let's see. Hi, Dr. Ross. Wishing you all the best, all your current and future endeavors. Thank you. Thank you for all your help. You're welcome. Let's see. I recall you stating in a prior webinar that you don't recommend having patients take glutathione to promote mycotoxins prior to doing the real-time test. Instead, you indicated that patients should take a hot bath the night before the test. Is that right? Why do you recommend this? And if you're already detoxing and any provocation necessary, is it important to keep provocation or the lack thereof consistent? Thank you. All right. So the idea with trying this idea of provocation is to try to get your body to release more toxins so you have a better chance of measuring it. All right. And so the real-time test is, as many of you know, is designed to see if you happen to be peeing out excessive amounts of mold toxins. When it comes, though, to detoxing mold toxins, your better organ that does that is actually the intestines, okay? And and the liver is supposed to help, but the liver doesn't do a good job. But I don't, I understand that some of the clinicians out there are using glutathione to provoke. However, I don't understand, there's no science that says that taking glutathione causes you to pee out more toxins. All right. I just want you to know it's not there. And if you look at the mechanisms by which you would pee out mold toxins or even poop out mold toxins, the liver, which is what uses glutathione to detox, doesn't break down mold toxins adequately. And I don't see how the glutathione helps the kidneys release mold toxins better either. Okay. All right. Now, the reason I therefore advocate doing heating up is when mold toxins, some are in the blood, but a lot are stored away in your fatty tissues. Okay. And so when you heat up, the act of heating you up, whether it's a hot bath, infrared sauna, going for exercise before you do this, heating up causes toxins to mobilize out of your tissues and move into the blood, where the kidneys then can pee more of them out. Okay, so the reason I advocate heating up over taking glutathione is I don't see the mechanisms by which glutathione would work. I know some of my colleagues recommend it, but when I look at the science on that, I just don't buy it. Okay, but heating up does make sense to me, and you might um, the you might enhance your ability of getting a better test by doing the glutathione first. Frankly, I never did it in my practice. I understand there's a theory that you might enhance it though. Okay. All right. So Doug, does that answer your question?
Yeah, it sure does.
All
Um,
right.
can I make it a little more complicated?
Yeah, no
Yeah,
problem. I like complications. Yeah.
I didn't want to go on and on in posting the question.
Yeah.
And this is one of the reasons
Oh,
why
Doug,
I
hold on.
struggle.
Doug, hold on just a minute. I've got somebody knocking at my door. Just a second here. I'm sorry.
Okay.
All right. Sorry about that. I misunderstood that. Evidently, so I'm having the outside of my house is being painted. What I was hearing is them knocking on my walls. I hope it doesn't get too loud in here. We'll find out here in a minute. But
Well, I can't hear it
yeah,
right now, so.
yeah. Go ahead. Yeah,
All right, so I've had the real-time test 4 times,
yeah,
21, 22, 23, 24, and I was like banging my head against the wall trying to get better.
yeah.
It turns out I was living in a moldy place.
Right.
Finally fixed that last summer, so I may be ready to take it again.
Right.
But the first time I took the test with no mycotoxin, with like very few, with a low
Yeah.
level of mycotoxin showed up. And
Yeah.
then the next year, 22, it was like off the charts. It
Mhm.
looks like I was able to, my body was moving them for one reason or another. And I was on, a much stricter diet. I was trying to detox as much as I could,
Yeah.
naturally and so forth. And then it started to go sideways when I realized in 24 that I had a mold problem.
Yeah.
So if I'm already showing significant levels of mold toxicity, do I need any provocation whatsoever? Like, what's the
Yeah.
point?
Yeah. So usually what I tell people is be consistent in how you're doing it. If you're going to be comparing one time to another time, use the same method you did before. Meaning, if you
Yeah.
provoked, fine. If not, because you want to compare apples to apples. Okay. The
Right.
second comment I would make to you is one of the things we find sometimes is that when you are really full of toxins, um, your ability for your kidneys to even pee out the toxins goes down. And as you start detoxing, pulling out those toxins, your kidneys can detox better these toxins. Again, the kidneys are not your main way you detox these toxins. It's a minor pathway, okay, but we can still measure them there. But one of the things that can sometimes happen is when we start binding people, they come back 6 months later and suddenly their whole mycotoxin test looks horrid. It can look just a lot worse than the beginning ones. And one of the reasons that can be is that their kidneys are just able to pee them out better because you've removed a load of toxins and the kidneys can start working better. And so you can measure it now. Okay. And so the way you have to interpret some of these follow-up tests is you also have to ask your patient, how you doing? So is anything looking better? So in a situation where the urine mycotoxin test looks worse on a follow-up after you've been detoxing, but somebody says, yeah, I'm getting a little bit more energy, my brain's starting to work just a little bit better, I'm not quite as achy, that may be a positive, it just may represent improvement, okay? So these tests have to be interpreted in light of what you're doing and in light of how you're feeling. What are your symptom profile looking like too? Okay.
Yeah, I got it.
All right. Good luck to you,
Yes.
Doug.
Yeah. Thank you very much.
You're welcome. All right. Does anyone else have a follow-up question to what we were just discussing there then? Okay, let's move on here then. All right, let's see. Hello, Jim. Let's see. My wife has been diagnosed with ALS as well as Lyme and Babesia. At your suggestion on prior Zoom call, she was tested for Bartonella via Igenix fish test, and it came back positive. At the same time, she had her IgG tested. IgG1 and IgG2 are below normal, while her IgG3 and IG4 and total IgG are at the very bottom of normal. Will the low IgG hinder her healing? She's on azithromycin and rifampin. Does low IgG skew the results of any antibody test? That's a good question. So yes, if you have immune suppression or immune deficiency, I guess I would say in this situation, it can make it so you just, when you're doing antibody testing, like the immunoblot method from Igenix, for immunoblot for Babesia, immunoblot for Borrelia, immunoblot for Bartonella. These are techniques to measure is your body making antibodies that attach to proteins found on these germs, okay? So yes, it is true. If you have lower IgG levels, you may have a hard time developing a positive test, okay? But the fact that she did get a positive test means there was enough. Okay. All right. Now, the question you're going to run into is, given that she's got these lower levels and given she's got a difficult to treat illness, would it make sense? And this is something you would have to work with a neurologist on to get approval from insurance, but it might make sense to do IVIG infusions as well too. It might make sense, but that's something I suggest you take up with your neurologist as well too. Can she still recover with those lower levels? Yeah, but it might be better. It might be, and I'm just saying might because there's no studies that guide us on this, okay? But intellectually, it might be better to see if you can elevate those IgGs by doing an intravenous IVIG infusions, okay? Now, having said that, I'll let you know IVIG is not the easiest thing to do. It's costly if insurance doesn't pay for it. You get, because these antibodies are actually pooled antibodies from a bunch of donors, you're getting parts of their immune system in. Sometimes we have reactions to those as well too, all right? But it sometimes can be helpful for people, okay? Jim, do you have any follow-up on that?
So thank you for that.
Yeah.
If her IgG is low, or for anyone for that matter,
Right.
would that affect their ability to recover if their immune system is not generating like a full response?
So what I would say is it might, and I don't mean to be obtuse here. I do mean it might. I have seen people with low antibody levels actually recover. But I will tell you, in theory, it makes it harder. Okay. And so that's why I was saying you might want to talk to the neurologist and see if they'd be willing to help look at IVIG.
So regarding the neurologist, that's always an interesting discussion because, the neurologist immediately rejects, any testing from Igenix,
right,
including a fish test.
Yeah.
So I had a pretty lengthy argument with the neurologist about a week ago, asking the neurologist to look at the complete picture. And even if the neurologist happens to be correct and Igenix is throwing false positives as some doctors claim, which I don't believe, by the way, but that's what's out there, that look at the whole picture. Like, why would the IgG be low? Why would some other numbers be high? And
I agree with you. I mean, I just point out something here. The one thing, all these specialists that, are towing the conventional party line against IGeneX. There's one tool you have in your belt now that a lot of people may not realize, and that is the FDA has finally approved the IGeneX methodology, the immunoblot methodology for an interpretation for IgG antibodies against Lyme. So the FDA has approved a test kit from IGeneX using their immunoblot methodology for IgG testing against Borrelia, therefore validating that IGeneX is not a crank lab, okay? Now, whether that matters to your neurologist who may have a preset mindset is a different issue, but I just want to point that out, okay?
So my last follow-up on this, and thank you for that. We've been referred to an immunologist.
Yeah.
And, I fear the immunologist is going to take the same stance as the neurologist. And I guess my question really is this. What are your thoughts on PCR testing from other labs for Bartonella? Like for example, Arup Labs, I think, has a PCR test. I want to say Mayo Clinic has a PCR test.
Yeah.
If I'm getting a positive fish from IGeneX, do I have any prayer of getting the immunologist on my side through some other form of testing?
It's hard to say because they're going to look at just knowing how the other side works, how the dark side works. They're going to say it's an independent lab, and because FDA has not approved the methodology, and the only reason FDA hasn't approved the methodology is IGeneX hasn't tried to make this test mass marketed to sell to other labs. So if IGeneX was selling its Bartonella test kit to another lab, they would have to get FDA approval, okay? But they're not. Just because they're not selling to another lab doesn't mean it's valid. And I would agree, if it's being seen under a microscope, it's a direct test. You can't deny that. Now, whether the dark side agrees with that is a different issue. Okay, they're very stuck in their ways, and they're not willing to look at some of these alternative tests. Now, in terms of PCR testing, if you were trying to do it through a Mayo lab or you try to do it, they might buy it because they're going to say, "Oh, it's a regular lab," and they said it was there. The difficulty is with any of these direct tests, meaning I see it under the microscope, which is a fish test, or PCR, which is we've been able to measure the DNA particles of this germ, or a culture, is that these germs don't readily live in the blood. So when you do your blood sample, it's easy to miss the germ and not have it be in your sample. And so you get back a negative test, which a negative test doesn't mean you don't have it. It just means in that sample, it wasn't picked up. Okay. And the problem with direct testing for Borrelia and Bartonella is none of the labs that are doing direct tests, whether it's Galaxy and its PCR testing technique for Bartonella, or IGeneX with its fish test, or T-Labs, Dr. Mozignani and his T-Lab microscope, none of them have done what's called sensitivity testing, meaning how good is your test at finding it in known samples? None of them have done the sensitivity testing. And I think in theory, though, we do know from Borrelia, there's good studies on Borrelia that the PCR method in Borrelia only finds Borrelia 30% of the time it's there.
Last question, should anyone getting an antibody test get their IgG levels tested to see if they would even generate an antibody response?
It's a good question. It is something I might do in my practice if I've got somebody that has other things that make me think of immune suppression, like they get every virus that comes along and they don't do well, that kind of a situation. But I didn't do it. It's a good question. It wasn't something I did regularly with my patients, though. Yeah. All right. Anybody have any follow-up to Jim's comments there? I see Zoom Jabruker. Hi.
Hello. Hello.
Hi. Yeah.
Hi. Hi, Marty Ross. It's nice to meet you.
You too.
I was bitten in Greece 2 years ago, and I'm diagnosed with chronic Babesia divergens and Bartonella. And my question is, how long do I have to treat for Babesia divergens? Because I treated for 4 months already with combination tefnikine and Mepron.
Yeah.
But still suffer from shortness of breath when walking upstairs or during exercise like cycling. And I also still suffer from burning nerve pain in the legs at rest and muscle twitches in the around the calves.
So again, I'm sorry to do this, but I'm only taking questions that people post in the chat box. And these other questions I'm taking are follow-up to what we've been discussing from one of those posted chats. So I'm not going to be able to answer that for you right now. Okay.
Oh, okay. I'm sorry.
All right. Yeah. All right. And then I saw one other person's hand up here. I think, who was it? Hold on. Let me see if that moved over. No. All right. All right, everyone. I'm going to move on here. Oh, it's Theo. Your hand was up. That's right.
Sorry, you were saying that the direct testing, none of them have real sensitivity validation, and I just wanted to check that the Galaxy seems to have a new type of PCR. Are you familiar with it all? And do you have any thoughts on its
It's still the same issue, is if it's not in the blood sample, you're going to miss it. And
Okay.
no one has done that testing to find out how often that you sample is the blood actually contain it. We just don't know. So that doesn't clean up that comment that I have.
Thank you.
Right. In terms of testing, I think many of you know I have an article what I call about the best test. And I still think for all of these tests, as an initial test, it's the immunoblot that's best, because the immunoblot has solid sensitivity data that we have from IGeneX that suggest 93 to 95% sensitivity on the immunoblot testing for all the germs. Okay. And that's why I advocate going with that first.
Oh, the 93%, do you know if that's based on whether like antibodies are present? Like, does that include, like, if you're not making antibodies, is that part of the 7% that I mean, does that make sense?
So, I am not clear about their sampling when they did this. Did they know for sure that people were capable of making antibodies or not? So I can't answer that, unfortunately. Yeah. I don't know enough details about their data set. All right. All right, let's move on here. Colleen, let's see. Hi, Dr. Russ. A friend asked me a good question that I didn't have a good answer for. Maybe you'll know what to say. If Lyme testing is unreliable, why even test at all? That's a good question. So it's, as I said, I mean, your immunoblot methods are 93 to 95% reliable at finding it. So but there is an area there that is not perfect. All right. So the reason I try to get testing that's positive is, as all of you know, this illness can be so complicated to take care of. And it sometimes, let me reframe that. For about 15% of people with these infections, it becomes a difficult illness to take care of. And it happens probably be all of you here, okay? But for 85% of people, you can get rid of these things, okay? But 15% of people, I think it's a complicated illness to take care of. And because it can stretch a year, 2 years, 3 years, and beyond managing, it's very helpful to continue going forward if you happen to have a test that was positive somewhere along the way. It just gives further backup that you're not thinking to yourself, am I treating the right thing? Okay. That's the main reason I advocate trying to get positive testing. Does anyone have a follow-up question on that? All right, let's move on. All right. Hello, Aliska. See, hello. I was wondering, is there a way how to prevent autoimmune issues, please? All right. So there isn't, so when you have tick-borne infections, and whether that is Borrelia, Bartonella, Babesia, it is possible that they do set up a situation that you develop autoimmune illness. in terms of trying to prevent that from happening, there isn't like a thing that you take that this is my autoimmune preventive pill. All right. What does work is getting your germs under control. That would be my response, is getting your germ loads down, killing those germs either with herbal or prescription antibiotics, lowering your germ load so that the body has less chance of developing reactivity. That's the best that we can do at this point. Okay. All right. Now,
Right.
if you do get autoimmune illness, then I like looking at low dose naltrexone as a means of helping to manage that. And I like working with thymus peptide bioregulators as an example. Integrated Peptides has a product called Thymogen Alpha 1, which contains 2 thymus bioregulators. And what LDN and the thymus bioregulators do is they can help elevate a cell called a T regulatory cell that is supposed to manage the various kinds of inflammation we have called Th1, Th2, and Th17. Okay. We think autoimmune illness happens when Th1, which are the cells that fight bacteria and viruses, and Th17, which are the cells that line just under your skin and your mucous membranes that fight invaders that are not known by the body. We think autoimmune illness is that Th1 or Th17 or both get overly turned on. What regulates Th1, Th17 are your Treg cells. And if we can bolster Tregs either with LDN or with thymus bioregulators, we can get better balance. But I haven't seen anyone using that as a preventive strategy, if you will.
Thank you. No, why I actually asked the question was that I actually want to thank you at the same time because I was asking you a question about my 10-year-old daughter.
Yeah.
She just turned 10. You recommended that it didn't seem to you that there was enough attention being paid to Bartonella. So you recommended JK and the Cryptolepis, which we successfully started. And basically, at the moment, she picked up horseback riding classes and she's able to do them. So I am your eternal owner, okay, for basically giving the right advice. Now, I don't think we are out of the woods yet. And the reason why I asked the question, but I really just wanted to thank you because you have no idea how much I appreciate it.
Thank you.
And we went to doctor and we got back the blood test results. They were testing the usual blood work, but then they were actually testing for her immunity. And her immunity is still quite low. It's the T lymphocytes and also the natural killer cells. So they're quite low. And they suggested that she is going to pick up immunity medication to boost her immunity. And I'm worried that it's going to push her over to the autoimmunity. That's why I'm asking you, because I trust you, that if you say she can take it, I will give it to her, but I just want to make sure that there is no threat to her.
I understand. So a couple comments. So it's not uncommon that people with chronic tick-borne infections, when they're active, will have low white blood cell counts or types of white blood cells, as your daughter does, okay?
Yes.
And usually, as you treat, those numbers will start coming up. They will start improving, all right? So part of the treatment of the low white cell counts is knock the germ load down, okay? But, and I don't know what they're thinking of, they want to give her to stimulate her immune system. What I will tell you is if they're thinking of low dose naltrexone, I don't think you're going to have any problems with that, sending her too far the other direction, because again, it's improving T regulatory function, okay? And, or if they go with the peptide, like a thymus bioregulator complex, again, you're just getting the Tregs to work better, creating balance, which should not trigger into autoimmunity, basically, okay?
It's a type of transfer factor that it's only, actually it's being manufactured in Czech Republic.
Yeah.
So I don't think that it's being used in the States or anywhere really else outside of Europe. So it's a type of transfer factor that they're actually giving her. It's because she has been out of school until now. Because she was picking up every single virus or bacteria that was going along. And she has been missing a lot. So they left, I was homeschooling her until now. And
Sure.
now they saw that from the October, from the time we put in the herbal one, the cryptolepsis and JK, her NK CD and NK57,
Yeah.
it went up by 10 points. So it
Yeah.
is going up, but it's
Yeah.
going up kind of slowly. So they want to boost it so she's going to be able to go to school again.
So there's many different types of transfer factors, and without knowing specifically what one they're thinking of. So it's possible to use transfer factors that turn on your natural killer cells, for instance, and that would be fine in this situation. Okay.
Okay.
But without knowing specifically what the transfer factor is, it would be hard for me to comment whether that is a good or bad thing for her. Okay.
Okay. Thank you very much, Dr.
Yeah.
Ross. Thank you.
Good luck. Good luck. I want to just show everyone. I'm going to do a quick screen share here because I want to give everybody a place that they can look at more information about these Tregs that I was talking about. So take a look at somewhere here. Oh, here we are. Take a look at my Treat Lyme information site, and you want to just in the search bar, just write Tregs. You'll find my article. It's this one right here. This is where I talk about using low-dose naltrexone or thymus bioregulators to regulate autoimmunity by elevating Tregs, which quiet Th1 and Th17. Okay, all right. So if you want more information, that's where you would go to take a look at it. Okay, all right. And then Suji, I see your hand up there, and I hope it's a follow-up question to what we're talking about here.
No, it's not a follow-up. Sorry.
Okay.
Brand new.
Yeah. No. So for everyone, the way that these work, and I may not even get to your question, is we've got, I think, about 38 people that have written questions to me, but I take them through the chat box first, and then after I answer that question, then I open it up for further.
Yeah, sorry. This is my first time.
All right.
So.
No problem. All right. Let's move on here. Hello, Sarah. Let's see, is Dr. Yes, I am. That must have been from early on. All right, let me get rid of that. Let's see. Hello, Josh. Let's see. Thank you, Dr. Ross. Symptoms started on January 1 of 25. And after scans showing no issues in my brain, heart, lungs, or abdomen, I was diagnosed with Lyme by a doctor that also has Lyme and tested positive on an infecto lab test. Treating with doxy since February and started herbs the middle of March. Have my energy levels back somewhat, but left chest and rib pains, palpitation, spasm, twitches are driving me nuts, especially at night. Blood pressure is 110/70, average beats are 55. Read that some have treated Lyme carditis with 200 milligrams doxy times 2, so doc just upped me to try that out. Any thoughts on what else I can do about the chest and ribs issues to prevent any further heart issues down the road? Okay. So, Josh, I may not be able to give you the best response because I'm not clear that your chest issues are from your heart. I would need to know more information, like what your EKG showed. I will let you know that all chest pain is not Lyme carditis. Sometimes you can have chest pain that's Bartonella related, and the twitches that you're having have me questioning just that one symptom, okay, not knowing anything else about you, just that one symptom, would want me to explore with you a little bit further based on symptoms. Is it possible that Bartonella might be present in this as well too? Because Bartonella can give rib and chest pain as well. All right. So to put it in context, Bartonella symptoms that would make me think of Bartonella are things like air hunger, meaning you feel like you can't get air from time to time, even when you're not doing activities. Muscle twitches often can be part of Bartonella. Problems with your mental health, either pervasive ongoing anxiety or depression, sometimes makes you think of Bartonella. Severe cognitive issues, thinking issues, make you wonder about Bartonella. Pain on the soles of the feet can sometimes be part of Bartonella, and any neurologic issues can sometimes be part of Bartonella. Okay, so I would explore that with your physician and see if Bartonella might be at play with this as well too. Okay.
Thanks, Dr. Ross.
You're welcome. Any follow-up? Are you okay on that?
Yes.
Okay, good. All right. Elizabeth, I see your hand up. Oh, yeah, Elizabeth, yeah.
Yes, I do have a question lower down, but it's got my attention is the chest pain. I am having massive chest pain.
Yeah.
So I don't know if you want me to just step back and wait for my turn, but it's a pivot off of this whole chest pain thing because I've explored the whole cardiology thing to
Yeah.
like its ultimate end. And even though I may have a leaky valve, I've, CT scores, all the tests seem to be not showing anything along those lines. But I had Lyme and Babesia,
Yeah.
MCAS, the litany. I had these neurologic attacks, went up my back and then down my arm. And so now I'm past the worst of it. I'm functioning at a high level. But even yesterday, I just was crippled over sternum, right at the sternum. And so I've been using potent CBD cream to get out of it. But
So a quick question. Okay, so chest pain's complicated, and I may or may not be able to help you with that. But let me ask a quick question. Okay,
Sure.
so what is the nature of the pain? Is it like sharp stabbing, shooting, achy, or how can you describe the nature of it?
It is very sharp stabbing. Gosh, very deep.
It's deep,
Very
right?
deep, and I think, okay, is it muscle? Is it bone? Is it
It could,
tendon? Like,
and then let me ask you a few more questions. Is there a time of day in particular that it seems to come on?
often it had been at night, but yesterday I couldn't tell if it was because I had a major kind of emotional phone call with a relative that just distressed me to no end. And then I'm thinking, I'm in a massive flare. The whole thing just is going sideways. And I was in pain for like 10 hours the rest of the
Okay.
day on the couch.
All right. So I will say a few things, and again, it's just chest pain is complicated to figure out.
Yeah.
I feel good that you've had a cardiologist look at you because they've at least probably been able to rule out, they should be able to rule out, even in a female, which is harder for cardiologists to do sometimes, but they should have been able to rule out, do you have a blocked blood vessel limiting blood flow to your heart? Okay. They should have been able to do that. Okay.
Yes.
They
Yes.
also should have been able to figure out, do you have inflammation of the lining of the heart? We call that pericarditis. So the really bad things that could kill you, and I'm not trying to be crass, but that's what cardiologists do. Figure out, is it something that's going to do that? Okay. All right.
Right. Yes.
All right. All right. So then other things to think about that could lead to chest pain in tick-borne inflammation or infections is, especially the sternum, it could be that you've got inflammation of the joints where the ribs meet that. Okay. The other thing is when somebody tells me their pain tends to come on more at night, I'm wondering, are they getting acid reflux up into their food pipe? And a lot of these things we have you take for tick-borne infections can sometimes make it easier for acid to roll up into your food pipe at night. Okay. And so have they had you see a gastroenterologist yet to look into your food pipe and see if that could be happening?
That was so early on after these attacks happened.
Yeah.
And I was in the ER 8 times over 6 weeks. Of course, I did have a rash, but it wasn't bullseye. And my lips were exploding over histamine issues later, we learned. And they were like, okay, here's, what do you call the pink stuff that you take to for inflammation?
But question is, have you actually seen a gastroenterologist?
Well, I didn't cycle back because there were so many paths I was going down.
Okay.
I've not cycled back to answer you.
Given that the cardiac evaluation's negative, from what you've told me, I would at least probably circle back to the GI docs and just see, is this reflux or not? And if it's not, it may be inflammatory due to inflammation either of nerves, muscles, joints caused by the tick-borne infections. Okay.
Mm-hmm.
That's the best I have for you. Yeah.
Okay. And then what do you do? What's the best?
Well, if it is that you've got acid reflux, where I usually like to start is look at your medications and figure out which ones may be leading to it. And that could be your herbs too. Okay. And then secondly, I like to protect the lining of the food pipe. and that is to, which will decrease the pains you have, and that is to use preparation that has deglycerated licorice in it. When you chew licorice tablets, not candy, but the licorice
Yes,
herbal
yes.
tablets, all right? Your saliva and chemicals within the licorice mix together and form a microscopic gelatinous coat that covers your food pipe and your stomach and can be really soothing and protect and prevent that pain from happening. So, so it all depends if they find something GI wise or not. Then, if not, and again, as I mentioned earlier, at the last question or right before you here, is that with chest pain, always look for Bartonella. And I went through those type of symptoms that make me think about Bartonella as well too.
All right, and one last question to that. If I've had the IGeneX, the broader test that I thought would have covered that, and that came back negative.
Yeah, so the problem
something-
with Bartonella and Babesia is you can have them with negative testing. And so I always like to consider, do you have symptoms that indicate it could be Bartonella? And if you have enough, then I like to treat.
Okay.
And what I just did with the person right before you is I went through those symptoms that I consider. And if you have enough of them, then I say you have Bartonella. And I treat
Okay.
based on symptoms. Okay. So even if you didn't catch it during the recorded version of this, you'll be able to hear those symptoms all over
I
again.
will go
Okay?
back.
All right.
Okay.
The other thing you could do about those symptoms is in my treat Lyme guide, or I'm sorry, at Treat Lyme by Marty Ross MD, there is, I'll show you here. You can look, I have written these all down. So look in my online live guide here and look in the how to diagnose and look at this article, How to Diagnose Bartonella. And there's a section in there I review what symptoms make me think it's Bartonella, even if testing is negative. Okay.
Got it.
All right.
This is excellent. Thank you so much.
Good luck to you. All right.
Thank you.
All right. Let's move on here. Let's see. Meg, let's see. Good morning. As I wind down treating Lyme and my co-infections, how do I switch to focusing on getting my gut back in shape? I will stay on herbals for treatment for a while. All right. So Meg, I'm going to point you to an article to read, which has all of the information in it. And I'm going to just show you where that is because it's probably just going to be easier to do it that way. And that way I can get to some of these other questions. But let me just do a quick screen share here for you. All right, so take a look at my, let's see here. Look under, where's my stomach? There it is. Look in my stomach and stomach and intestine section here. And it should be here. Where are you? There we are. My guide called Your Guide to a Healthy Intestinal Microbiome, Even on Antibiotics. And I believe I have a whole section about how do you rehab your gut at the end of treatment. I'm just making sure that I really do have it. So this is a long article because I explain a lot of reasons I recommend certain things, okay? But down here at the bottom, here you go. This all the way at the bottom, but read the whole article because you're going to find out why I recommend everything I do, is this option 4 called gut rehab at the end of treatment. Take a look through this and it'll give you all the information you need. Okay.
I just assume that coming off of, the antibiotics one by one slowly, getting down to the herbals and then cutting them off, and as long as there's no flares, this could take several months. This is an instant thing, but sometime over the summer.
But then look at the ideas I have there about how do you rehab your gut as well too.
Perfect. Okay? But I think that's going to help. Okay, thank you.
Good luck. All right. Hello, Diane. Let's see. Hi, Dr. Ross. I hope you're doing great. I am. Thank you. Let's see. I haven't slept well since contracting Lyme and co-infections back in 1989. I had a sleep study done recently, and your experience is periodic limb movement disorder common among people with longstanding neurologic Lyme. Is it okay to take gabapentin with herbs and other nutraceuticals? All right. So, So I haven't seen higher amounts of periodic limb movement occur in people living with tick-borne illnesses. That doesn't mean that tick-borne illnesses don't cause it. I'm just saying I haven't seen higher amounts of it. Okay. All right. The only question I have, and I know they probably put you on the gabapentin because of the periodic limb movement disorder, is there is starting to become data that's telling us that chemicals that we use for a long time that interact with a receptor called the GABA benzodiazepine receptor. So this is where gabapentin binds. This is where your benzodiazepines like Valium bind. There's starting to be some evidence that it can, if you do this long term, it may lead to impaired thinking down the road. It's newer stuff, and a lot of people aren't familiar with it, but I would discuss this with your neurologist, your sleep specialist, and say, is there an alternative to gabapentin? Okay, that's what I would do, because I would presume this is something you might need to be on over time. Okay.
Do you have any
questions?
suggestions for other medications rather than that aren't going to affect your thinking? Because I have to tell you, I've already got thinking issues anyway because of the Lyme disease, the long-standing stuff. So yeah, if there's any other ideas that are not going to affect my brain in the same way.
I don't know off the top of my head. This is one of those things. If I would have to go, I would have to investigate a little bit more myself and see what the literature tells me on it. Yeah.
Okay. Yeah.
Right.
Thank you.
All right. Good luck to you. All right. Magdalena, let's see. My Lyme doctor prescribed me numerous times glutathione, but after a few days, oops, somebody's got their microphone on. Oh, that's you, Magdalena. Hi.
Hello.
All right. Let's see. My Lyme doctor prescribed me numerous times glutathione, but after a few days of taking it, my symptoms became almost unbearable. Stiffness, moving becomes very difficult. Why? So there's one of two things happening. So sometimes when you take, if you've had a lot of obstructed detox over time, glutathione is your main detox chemical, okay? And you can kind of think of it as if you've had a detox block, it's like a roadblock, and you've got all these chemicals built up, they're ready to be toxed out, and suddenly you take glutathione, it pulls down the roadblock, and all these toxins come through and hit your liver, and they start being detoxed, all right? That can be inflammatory sometimes. That sometimes can trigger too many cytokines, okay? So one of the things you might want to try to do is not necessarily write off taking the glutathione, but go back and try it at very low amounts first and see, can you find a dose you'll tolerate? Okay, sometimes you have to do that. Okay, all right.
I tried 200 milligrams, but still couldn't.
You might even go lower than that. Okay, all right. The other problem with glutathione is there is an issue with people being able to handle it due to sulfate issues. And I always blank on this one. There's a mineral, I think it's selenium. Actually, I'm going to ask one of my resident experts here, Alba Nasir here. What is the mineral we're supposed to use for this again?
I'm taking selenium anyway because I have
here,
Hashimoto's.
but I guess, are you talking about sulfur?
Yeah.
Yeah, it's molybdenum.
Molybdenum, yeah. It's working with molybdenum. Thank you. I don't know why I have a mind block on molybdenum for this, but
I'm here for this, I guess. I'm here for this.
Thanks, Alan. So molybdenum can sometimes, if you get on molybdenum, and I think it's, I believe it's 200 to 500 milligrams a day. If you get on molybdenum, it can make it so you can then tolerate the glutathione. So you might want to look into that then.
It's micrograms.
Micrograms. Okay. Okay.
Yeah. Like I said, for some reason I have a block on this one. So thanks, Alan.
Thank you very much anyway.
You're welcome. Good luck to you. All right.
Thank you. Thank you. Happy birthday.
You're welcome. Let's see. LJL. Hi, Dr. Ross. Any advice for a 67-year-old male who has chronic anal fissures that will not heal? despite us trying everything that we have read about in articles and peer-reviewed medical journals to heal anal fissures. His health background is Crohn's disease since 20, and he had knee replacement surgery in January of 2025. Thank you very much. You know, it's an area I have not looked at in some time. Okay, so I'm just gonna say that to you. The only thought I have, and I can't, is something you might want to consider. I would have to look into a little bit more, but there is a peptide made in the stomach lining, which is called BPC 157. And BPC 157's job is to heal issues within the intestinal tract. All right. And the anus is part of the intestinal tract. All right. The other thing BPC 157 does, and we know from athletes, is it's great at healing tendon and muscle injuries, joint injuries, and neurologically, we see it very helpful at repairing nerves. So it tends to be the repairing peptide, if you will, out of all the peptide options you could try. And what you might consider doing is give it a 3-month try, see if it's going to make a difference. I will admit there's no studies I've seen on this, but it would be something I would consider trying just because I know it heals other things, other injuries. And also, since it's made by the stomach lining and its job in the intestines is to heal and keep the intestinal tract functional, and the anus is part of the intestinal tract. Okay. So BPC 157, and I would do a 500 microgram pill, 1 pill twice a day. Give it at least 3 months to see if it will work for you or not. Okay. LJL, did that answer your question for you? All right. Let's move on here. David says hi from Chico, California. Hi, David. Let's see. Mark. Hi, Dr. Ross. Thanks for all you do. You're welcome. I have tried IV antibiotics, 6 weeks or triple oral antibiotics, but can't shift Bartonella and Borrelia. I tried methylene blue twice and felt absolutely dreadful on it, worse than having Lyme. I'm on the usual herbs, crypto, artemisinin, biodisrupt, NAC, also on fluticasone for POTS and Distention, and low dose naltrexone for symptoms. Anything else you recommend? So I will. I'm going to give you an idea, but to really know what to really recommend, this would be like an hour and a half we would spend talking, okay? Because I would really want to know more what happened along the way with each thing you tried, more about all of your symptoms, et cetera, et cetera. And we can't do that in this format, all right? But the one thing that I have found helpful with a number of people with Bartonella especially is there is helping to repair what is known as the endothelial glycocalyx. And so your blood vessels have a layer of cells that line the inside. Those are called the endothelial cells. Bartonella infects the endothelial cells. Covering the endothelial cells is a layer called the endothelial glycocalyx. And so you've got your blood flowing, and then right on top of the endothelial cells, between the blood and the endothelial cells, is this layer called the endothelial glycocalyx. And we know that, especially we know that COVID disrupts that endothelial glycocalyx. And there's growing science that says that infections in general of the endothelial cells can damage the endothelial glycocalyx too. Now, why that's important is one of the products that gets made by the endothelial glycocalyx is nitric oxide. And nitric oxide is responsible for dilating up your blood vessels so that your antibiotics and all the stuff you take get further into the really small blood vessels, all right? So I think in some people that have a hard time recovering, especially from Bartonella, is that they've got limited blood flow deep into the tissues. And the one thing that can do that is endothelial glycocalyx injury results in ineffective production of nitric oxide, and therefore people just aren't getting adequate blood flow. So the remedy for that is to take a seaweed product from a seaweed called Monostrum nitidum. I love that name. And there's an extract from Monostrum nitidum called ramen sulfate that has been shown to rebuild the endothelial glycocalyx. Okay. And so the product for that is called Arterisol, has ramen sulfate in it. The way I have people start is at 2 pills twice a day for a month. And then after that, decrease it down to 1 pill twice a day. And as long as your body is still having to fight Bartonella, stay on it. All right. Usually within 2 months, you're going to know if you're getting benefit. If not, after 2 months, stop it. But give it a try. There's a number of people here that are reporting good improvements on it as well, too. And that would be something for you to think about. Okay. All right. So, Mark, do you have any questions on that?
That's great. Thank you. I have got some Arterisol.
Okay.
But I took it in conjunction with the methylene blue, and I just felt so rough that I stopped both of them. But maybe I'll restart without the methylene blue and see how it goes.
Try it again and try to make sure you're using enough of it as a starting dose. I haven't seen anyone that I've recommended it to that felt worse from it. I'll put it that way. So the feeling worse may have been more related to just the methylene blue. But yeah, so I would consider that as something that might be a missing part of your regimen then. Okay. All right. And good luck to you on that. Yeah.
Thank you.
And then let's see, I see Zoom Jabruker. You've got your hand back up. Nope, I guess not. And then Lucy, I see your hand back up again. Is this pertaining to this line of questioning here?
I'm sorry, I'm in a public place. Yeah, I've had such good results with the Arterisol. The blood pooling was causing paralysis. Like I couldn't stand up, I couldn't walk.
Yeah.
It's improved the blood pooling a lot. I can only tolerate 1 cap twice a day.
Okay.
And I'm, busy with the MCAS. Mold has reduced significantly over 3 years.
Yeah, I will.
I can't go near the Bartonella at all because of my sensitivity.
Yeah.
And the next on deck is the Candida. And I'm just wondering, any suggestion, at this point?
So it would be hard to say what to do. Again, especially when people have got a lot of sensitivities like MCAS involved, et cetera, I can't give you a quick off the cuff kind of response on that. I would really need to spend time getting to know more about how the illness has affected you. So unfortunately, I can't give you a response on that.
Okay. And with the, since the blood pooling is going well, just stay on the 1 cap twice a day for as long?
I would, because figure you're still going to keep having injury to your endothelial glycocalyx until you get that Bartonella especially taken care of. And so you need to try to fix the damage being created to the endothelial glycocalyx, likely from the Bartonella. Okay.
Would you say that the Bartonella might be more important than the Candida?
Boy, so again, I can't specifically say without knowing everything that's going on with you. And again, I don't have the ability to do that in this kind of a format. Okay.
Okay. Thank you so much.
You're welcome. Good luck to you.
Thank you so much.
All right. All right, let's move on here. Diane says, happy belated birthday. Thank you, everyone. I see a couple more people said that, or Aliska said that as well, too. Thank you to both of you. Let's see. Elizabeth, get rid of that. So Sarah, I see this is your question that we talked about earlier here. Let me get rid of that. Elizabeth, let's see. July 24th to 2nd, attached ticks 4 days. Thought they were spider bites. Useless barba, let's see, treated. Mild lymphedema on October 24th. Tested Bartonella henselae IgG labs. Put me on tick immune support, TID, which have taken until present. I'm just kind of quickly reading through this. What I don't see is I don't see a question.
It's in several parts, Marty, because it was long.
Okay. Let me see if I can find your other parts here real quick.
Thank you. And I'm new to this, so this is kind of my first foray, and I'm seeing a new Lyme doc this afternoon. So I do have a few questions. If you can't find it, I can pick up here with it.
No, I'm seeing it right here. I
Great.
see. So what is your question then?
So my first test was positive for BART, and the symptoms that I'm describing that I think you're seeing, which is lots of lymphedema, lots of brain fog. I also do have skin breakdown, and I forgot what else because I'm not used to talking in front of people. But I do have a bunch of BART symptoms, and I assume I have it. That was from my first doctor visit and the positive. Then I went to a Lyme doctor, an elite Lyme doctor. I've been on a health regimen for 5 years and taken all kinds of supplements and do all kinds of exercise. Came in with many things, pro health, and I never got sick in my life. And she basically, I'd say she gaslighted me. She said, you do not have BART. I do not believe you have BART. People that come in here are very sick. She was not inquiring. She wasn't investigating. It was a terrible experience. $700. And then she ordered more labs. And then you'll see my next BART were both negative.
Oh, there it is. Okay.
Yeah. So I always hear, you base on symptoms. So that's one of my things. I feel like I have BART. Going back to my first Lyme doctor this afternoon, I'm going to proceed that I have BART. But do you have anything to say about the?
So, again, I don't, what was her follow-up test for the BART that she did? Do you know what the actual test was? Was it an IGeneX test? What was it exactly?
You mean, the second one?
Yeah.
Well, it was LabCorp and it's
No.
Bartonella antibody, it's IgG.
Yeah, you can't, LabCorp's not good quality.
Oh. And Medicare, is it because of Medicare? That's all they could do?
Well, I mean, that may be all that Medicare would cover, but then she should have had a discussion with you as to whether you wanted to use a higher quality lab or not, if she wanted to do further testing.
She offered me a $1,200 lab and I declined.
Yeah. So let me just ask a quick question. These are just my Bartonella questions. So you've got a lot of lymph nodes. Is that what I understood you to say? Okay.
On lymph nodes.
Yeah.
Terrible brain fog. Like I'm going like this.
So let me just do it. This is a quick rapid fire yes, no. Okay. So you've got brain fog, yes. You've got a lot of lymph nodes, yes. Do you have pain on the bottom of your feet?
I have skin breakdown that my skin burns.
Okay. Do you have any problems with ongoing anxiousness at all?
Hell yes.
Okay. I mean, is it, when we ask this, is it because you're scared about the illness, or does it seem like it's more organic and coming from within?
Pretty hard to separate out.
I bet. I can imagine. Yeah. All right. And then
I don't think it's free floating particularly, but I'm on meth blue and it's really helped that. That's helped a lot.
Okay.
But not so much now.
Any depression at all?
History of depression, and yes, I'm very depressed about my decline in fear. It's hard to separate out.
Any air hunger at all? Feel like you can't get enough air from time to time?
No.
And then besides the skin breakdown on your feet, do you have like any stretch mark rashes at all that have come up at all or not?
I have teeny little sores that's form, and they're little tiny and round, and I never had the cat scratch.
Okay. And you said you have pretty profound brain fog issues too.
Yes, and I have bloated veins, extremely bloated veins.
So what I can tell you, and again, this is in 2 minutes of talking with you, which is not a good way to make a diagnosis, okay?
Yeah.
I'm going to put all those whistle and bells around it, okay? But with that initial positive Bartonella test that you had, and with knowing that LabCorp does not offer the highest quality test, I'm not inclined to believe the second test. You have enough symptoms that make me wonder of Bartonella as well too. And I would consider 2 things. One, maybe that provider is not the best provider for you. And all right,
I'm not going back.
all right. And then number two, even if you decided to go back, you might want to ask what was this follow-up BART test? Because if they were going to offer you, if they need more proof themselves to treat you, then I would want to get the Immunoblot Bartonella test out of IGeneX, which should not cost $1,200. If you just do the Bartonella Immunoblot, it's a $450 test. Okay.
Okay.
All right. All right. Just the Bartonella, not everything else they might have wanted to do, but just the Bartonella test. Okay.
Immunoblot out of IGeneX.
IGeneX.
Because I'm going back to my first Lyme doc this afternoon, who's kind of half-ish, but I'll talk to her about that.
So let me show you what you can look at before you go talk to them. So take a look in my test section here. This article called "The Best Lab and Tests for Barton or Borrelia, Bartonella, and Babesia."
Okay.
And then down here, I tell you which IGeneX Bartonella test to get, including their test numbers. And this is the Immunoblot test. Okay.
Okay.
All right. All right.
But the lymphedema is extreme and has been completely consistent.
Yeah.
Would
Again,
that be, that's kind of classic, isn't it?
not well, lymph node swelling is. Lymphedema usually means you also have a lot of swelling as a result of that too. But the lymph nodes. Yeah, a lot of lymph nodes are often seen in Bartonella. It's a clue that Bartonella could be there. Yeah. You have enough going on that makes me wonder if you have Bartonella. And I would find a provider who doesn't discount you and is willing to work with you. That's what I would do.
I'm going back to my original person. All that she prescribed was azithromycin. She didn't even tell me she prescribed it, so I'm very iffish with her. But I want to give her the pairs that you suggest in your literature.
Yeah, just print off that article. You got, if it's somebody that is a Lyme literate doc, they know who I am.
Yeah.
It doesn't mean they always like me. My poor colleagues, there were all these patients coming into this say, Dr. Ross says.
Right.
Believe me, I know when I go to conferences, some of them run away from me, but but having said that, a lot of them really do respect my work. And if you just bring it in and show it to them.
I will. She prescribed an antibiotic. She didn't tell me she was doing it. And then it was just sitting at the drugstore. I'm going to start herxing with no, education. So I'm going to try to merge the two of you.
I got it. Good luck to you.
Thank you.
All right. All right, everyone. That's it. So I want to thank all of you that have been part of Lyme United. I just want to thank you for taking the journey with me the last couple of years. And at this time, just because of other things going on in my life, I'm going to have to move on from Lyme United. That doesn't mean I'm moving on from Lyme disease and helping people with Lyme disease. So my Lyme disease information site is still open, and in a week is going to fold into Marty Ross MD supplements under a tab called Lymeology Guides. Okay, so all that information still be there. I'm going to keep updating it on both my Lyme information site right now and eventually on the relaunched Marty Ross MD supplements. There will still be a tab called Q&A Webinars. That's where you're going to go in the future to look at my whole library of recordings as well as sign up. And in fact, later today, you'll see there will be a sign up tab on there. I've got to set up the Zoom sign up for next week on that. So I will be back with you next week, not as part of Lyme United, but the Q&A webinars will go, and we will have one next week at 6 p.m. Central Standard Time again. And so sometime this afternoon, you can sign up for that if you want to go ahead and do that as well too. Okay. All right. And for all of you that have been here, I really appreciated doing this with you. And I'm glad that I'm going to be able to continue it so we can keep the Zoom room part of this going as well too. So probably as soon as Zoom processes the end of the recording, I will then have to go ahead and do some edits, and it may be about 2 or 3 hours. And 2 or 3 hours today, you can still find, I will post up in the Lyme United recording space. I will post it there. I'm also going to post it on YouTube. You will be able to see it because it's posted on YouTube. It will be on my Q&A webinar page on my information site as well too. So sometime middle of this afternoon. Okay. All right. All right, everyone. Take care. Good luck.
Thank
See
you,
you
Marty.
next week.
Thank you.
Thank you. Bye-bye.
Yeah, you're welcome. Bye-bye.